YouTube, I'm Dr. Fox. Today, I'd like to talk about pregnancy planning for migrants in Japan. Okay, if you are a new migrant in Japan, what should you know about healthcare for pregnancy and childbirth here? Every country has its own cultures, traditions, and medical practices when it comes to childbirth and taking care of pregnant mothers. You should be prepared for the Japanese system to be quite different to your home country. If you're quite a new arrival in Japan and have no family to help you, it could be useful to join in with your new community so that you can get help during pregnancy and after childbirth. You can speak with a social worker, find local culture groups, join a faith group, or look for support programs for women who are pregnant. Every part of Japan has its own local government, and they can usually provide you with plenty of support and information in a number of languages. In most areas, community-centered programs are available to assist pregnant women, and new migrants are welcome to join them. Your local government office will be able to tell you your nearest ones. There are also many websites which offer multilingual information that can show you how to deal with the Japanese system and understand national ways of doing things. If you're in Japan as a refugee, there are different systems to help you. Okay, about Japanese prenatal healthcare. Firstly, you will want to find your appropriate healthcare provider. In Japan, this will usually be an obstetrician for pregnant women. You should have regular appointment with your healthcare provider during your pregnancy. There are many standard tests that you should have to make sure that you and your baby remain healthy. These include ultrasound scans, monitoring the baby's heartbeat, taking blood pressure readings, and blood and urine tests. You might also wish to undergo genetic screening. Your doctor will help you to get ready for the arrival of your baby. The majority of Japanese women give birth in hospitals or clinics, but in many regions, you may be able to choose to give birth at home with a midwife attending, as long as your pregnancy has been normal and has no complications. Your healthcare provider will advise you on eating a healthy diet, exercising regularly, taking a multivitamin with folic acid, and avoiding harmful substances such as illegal drugs, tobacco, and alcohol. Okay, let's talk about medical fees. You may wonder that, do you have to pay for maternal health care in Japan? Potentially, government agencies could pay for the majority of healthcare fees, depending on the length of your Japanese residency and the healthcare services you need. You will be asked to pay some of the expenses. Every local government has its own policies on subsidizing healthcare, and you can find out about these at your local municipal offices.